Welcome once again to Wamba TV. We are here with a very prominent person here within Obudhingiya district. Currently, he's a senior advisor to the king, and he's also a retired medical worker. We are happy to have you, Oweng Kamuhanda Tomasi.
Thank you very much.
It's a pleasure having you today. Before we go far, say hi to our viewers.
I want to greet you and welcome you to the new year. Happy New Year to each and everyone who is our viewer. And I want to thank our sons who have initiated this Bwamba TV programs so that our voice can be heard elsewhere in the world. And information is power, and social media is power. I also happen to be a journalist. I was a presenter of UBC Kiswahili language and Lingala. So I have the pleasure to be with him so that I can give information to the people of Obudhingiya and Uganda. I thank you.
Thank you so much, Oweng Reverend Kamuhanda Tomasi. We are happy to have you. And there has been so much talk about the health sector here in Obudhingiya. And one of the issues that have been contentious in the community is the issue of negligence in the hospital. Patients are dying in the hands of health workers. There have been issues of extortion. You have to pay some money to access certain services. Late coming, absenteeism, and so much. I want to get your insight on all this that is happening, your general picture.
Okay. Thank you very much. Allow me to talk on each point presented. For example, negligence of duty as number one. As I can see, because I retired in 2015 in September, and I've been a staff of that hospital, and when we are talking about the hospital health sector, allow me, we talk about it general view of health sector in Obudhingiya. The negligence they are talking about, at times it is a wrong perception from the community. For example, the government of Uganda buys drugs for the health facility, all health facilities in Uganda. But you find that a certain disease, a patient has come, the nature of the sickness is not required to be prescribed this type of drugs the government buys. Because government buys essential drugs. As it buys essential drugs, it is our role as health workers to guide you, my dear. The way you are sick, and that we need you to buy A, B, C, D, so that you can get healed.
Because as a health worker, you think that the medicine which the government has bought may not work for you as a patient.
Yes. For us, according to how we prescribe, according to how we treat patients, because there are different types of diseases which can be where we can prescribe the medicine from the health facility and cannot work on your sickness.
Yes.
So, with a good heart, a health worker or a doctor prescribes the drug from which you can buy from a pharmacy.
Yeah.
So, you bring it, and the nurses give it to you according to the dosage. But the wrong perception from the community. One, when you say go and buy ABC, they say, the government brought that drug, so they took it to their clinics So
they want us to go and buy
specifically here, that doctor has sent me to his clinic so that I buy that drug.
Yeah.
That is how it is. It is a wrong perception.
Yeah. Okay.
Okay?
So it means the community has a wrong perception of the health.
Yes. Then number 2 on negligence. If I tell you go and buy drug ABC, and I ask you, you haven't bought it, and you keep without taking any medication, you say they have been neglected. They just come and pass by me. They don't even talk to me. When we have tasked you or your attendants to go and apply the medicine,
and you got both,
so that we can administer it on you, then you will begin recovering if God allows. Then the negligence they are talking about in health in health facilities, we don't stop death.
Yeah.
We treat and God heals. Even if they take you to London, you can die from there.
True.
Whether 100 doctors are surrounding you. When your time comes, it comes and you cannot reverse it.
Even the Queen of England died.
Died, yes.
If it was,
did he fail to have the money?
The money was.
Did he fail to have the required drugs?
Everything she needed was there.
So death is inevitable. So the negligence, as you have seen, it is not there only. Our health workers, they are lacking motivation. But in the whole of Uganda, I want to tell the viewers, in the whole of Uganda, it is only Obudhingiya Hospital which is still having free services. I've been in Mulago yesterday, but one. They told me the scan of the health facility of the government, I must pay 70,000
to access it.
To access it. Only the service I access on a free basis is urinalysis, the lab services. That is free. But with the PSA, I paid, and the other tests, I paid. So even if you go to Fort Portal, there are no free services as if they are in Obudhingiya. Obudhingiya is still working, the health workers in Obudhingiya are still working wholeheartedly to serve their people.
Where is all this coming from? If indeed
lack of motivation, I even when Mr. Mutegeki was the admin Obudhingiya Hospital, we went with him to the ministry, and I was still the deputy premier. I told the permanent secretary by then, before the Yana Twine came in the whole of Uganda, it is only the Obudhingiya Hospital which doesn't have a private wing. Because the purpose of a private wing is to motivate the workers, whereby at the end of the week, when someone is going for off, they can get that small money, they buy a bar of soap and goes with it at home.
But the president increased the salaries of those health workers. Isn't that motivation enough?
The word salary, a poor person here on earth is someone who earns salary. Because eating does not wait for you to take care. At the end of the month, it is when you will eat. No, it is daily service delivery.
Yeah.
To service the stomach. Okay, but with this motivation of private wing, wherever they are, beginning with the Fort Portal and elsewhere, in the government health facilities, they all have private wings.
So the money from the private wing is supposed to...
It is the motivation of the workers.
The staff.
Yes. Motivate the staff. But here in Obudhingiya, totally they refused for all those years.
What's the reason?
I don't know. That is from the ministry. Number 2, negligence they talk of. It is almost over 20 years. A district hospital without having an X-ray. And even
years, and the X-ray is not working.
X-ray is not working. The scan is not there.
Is the government aware?
A radiographer is paid, but he's not at home. What can he do?
So they recruited a radiographer.
Yes.
And the district doesn't have
an X-ray or a scan. So the community in Obudhingiya, They are suffering.
Do these leaders of ours, the members of parliament and those others in Kampala, do they know of these things?
They know, and they present them. Then, if you go to the theater and the other units, the equipments are not there. They're not there.
So now, where does that leave a common person like me? You go to the public hospital where you're supposed to get the services, there is no scan, there is no x-ray.
The negligence,
that leave us?
Negligence is government.
That's negligence on the side of government.
You have come already. You need to. You need a scan. You need an X-ray. Then what can I do when the facilities are not there?
Nothing.
And you say I've neglected you. No, there is no negligence. We are lacking. The health workers are lacking what to use. They are lacking motivation. They are lacking appreciation. Even the district cannot say, thank you, you have done this good. In the whole of Uganda, it is only the Obudhingiya Hospital where there is still free services. This is why there is still what? Free services. And I appreciate them and I thank them very much for that spirit of patriotism.
And then now, Reverend, where does the allegation of extortion come from? Extorting the community. Where does it come from?
Extortion of money from patients. I don't think, because there is no evidence. There is no evidence. I want to give an example. In our culture, if a birth attendant at home delivers your wife, even I told it to Dr. Diana when he visited the hospital when I was working there. The extortion we are talking about, it is an appreciation. You have conducted a self-delivery to my wife, and according to our culture, they tie a coin on your wrist. And that coin, you remove it from there when the umbilical cord has gone off.
Yeah, it's a form of appreciation.
It is a form of appreciation. You can't remove it before. You can't use that money they have tied on your wrist before the umbilical cord has gone off. So that's why when they hear that someone has paid 10,000 to a midwife who delivered their mother, they say that is extortion. No, because people, the perception, there is what they call corruption. With the corruption, someone charges you before service. But I've conducted my service, the services have delivered to you, I want to go home, and you say, you come and get a cup of tea. Is that corruption?
No. But Reverend, there are allegations that, like for example, a woman wants to deliver, and the doctor says you have to pay 200,000 before you enter the theater.
For cesarean section,
yes.
That is false. It is not there. Otherwise, in Obudhingiya here, I don't think that is there. No.
I know there are people who are watching us right now, and they have at one time passed through what you're saying is not true.
Yes,
I'm knowing them.
I'm standing on my two legs. I served in this theater for 7 years. I did not see it because I'm talking from the best of my knowledge, but I'm a health worker who served in the theater for 7 years.
Or maybe it started after you had left.
No, it is just a perception, a wrong perception, just a misconception, a wrong perception. At the same time, it is an allegation, a false allegation.
So, should we say there is an information gap?
Yes.
Why?
Information gap. Why? We have a health educator in the hospital. It is true, I've never seen him one day, one time, trying to conduct health education to the patients in the OPD. That is his work. Even in the morning to come and conduct health education to the wards. Even attend to them to hear their questions. Because from that ground, it is why he can note some other contentious issues and share it with the MS or with the in charge, the ward in charge. But the health educator, the health assistant doesn't do that. He's there just earning the money for